Bergson, and I'm going to talk to you a little bit about what we call primary hyperparathyroidism, which is a disorder of overactivity of the parathyroid glands. So let's talk about what the parathyroid glands are. The parathyroid glands are 4 little glands that sit in the lower part of your neck, 2 here and 2 here. And they produce a hormone called parathyroid hormone, which is involved in controlling your body's calcium level. This is a picture of the thyroid gland when viewed from the front. This is the trachea or windpipe, and this is the larynx or voice box, and the thyroid gland is sitting right on top. The parathyroid glands sort of sit on the back of the thyroid gland. So this picture is as if the gland has been picked up and turned over, and it may not show up that well, but there are these 4 little yellow, they're described as yellow on this picture, 4 little glands, 1, 2, 3, 4, and again, these are called the parathyroid glands. Parathyroid glands produce parathyroid hormone, which is involved in controlling your body's calcium level. Basically, what parathyroid hormone does is it elevates or increases the calcium level in your bloodstream, mostly by pulling calcium out from your bones and depositing it in your bloodstream, and increasing the calcium absorption from your intestines and also with your kidneys to preserve calcium and increase calcium uptake into the bloodstream. So basically, the parathyroid hormone raises the calcium in your bloodstream, and the calcium that's in your bloodstream gets used up by the various chemical reactions that are going on in your body. In primary hyperparathyroidism, what typically happens is that one or more of the glands becomes overgrown and overactive. It's not a cancerous process, but it's just an overgrowth and an overactivity. A gland will become enlarged, and it will produce high levels of parathyroid hormone. The culprit is one gland of the 4 in about 80 to 85% of cases, and it can be more than one gland in the remaining 15 or 20%. So what happens? Well, the parathyroid gland produces high levels of parathyroid hormone, more than it should, which results in elevated calcium level in your bloodstream. Now, normally, when the calcium level in the bloodstream is elevated, the normal response of the parathyroids would be to turn off and decrease their production. But in this disorder, the overactive gland does not shut off. It just continues producing high levels of parathyroid hormone. The result is that the calcium becomes very high and the parathyroid hormone level stays high. And that more or less is diagnostic of the disorder, high calcium and high parathyroid hormone level. What is the result of that? There's a number of issues that can develop. A lot of that calcium is being pulled out of your bones and deposited in your bloodstream, and so it can result in bone loss, osteoporosis. And as it progresses further, the osteoporosis can become severe, and people can even develop fractures upon minor trauma. They can have what are called pathologic fractures, meaning that the bone breaks in a circumstance that you would not expect a normal bone to break. All that circulating calcium through the bloodstream is being filtered through the kidneys, and it can result in kidney stones. It can also damage the kidneys, both from stones and just simply from the high calcium filtering through the kidneys. Those are the big, obvious things that can happen, but many people don't have that. There are some more subtle findings that can occur with primary hyperparathyroidism, things like fatigue, anxiety, mental fogginess, things like that. A little hard to quantify or define, but quite common, often after surgery, which we'll talk about, and after the problem is resolved, people will comment that they feel better, they feel more clear, they feel more energetic, things like that. So the diagnosis comes from basically the blood work. High calcium and high parathyroid hormone, with some rare exceptions, is pretty well diagnostic for this condition. And in the next video, we will talk about how we manage this and what the treatment is, which is basically surgery. Okay, so I hope that was helpful.